Double-click on the handpiece button to open the first margin group. The medial group will open first by default. Place the tip on a selected measurement site of the relevant margin. The tip attaches itself by light suction, and a measurement is triggered automatically. Real-time audio-visual indicators display a positive or negative outcome. 1 beep and a red bar for positive, 2 beeps and a blue bar for negative. Apply the handpiece to a total of 5 to 8 evenly spaced points on the margin. In particularly large margins, up to 12 points may be sampled with the device. The counter on the right-hand side of the screen indicates the number of sampled points in the current margin. If there are any additional points on the margin which are suspicious by palpation and/or visual inspection, measure them with the margin probe as well. Double-click the button to close the margin group. Double-click again to open the next margin group. The lateral margin will open next by default. Repeat measurements as with the previous margin. Double-click the button to close this margin. Double-click again to open the next margin group. Continue in the same manner to sample all remaining margins for a total of 6 margins.
Okay, it's right over the tumor here. And it seems to be too close there as well.
Once all 6 margins have been sampled, turn your attention to the margin probe screen display. Results from all measurements are displayed on the screen, grouped by margin. Any margin that includes 1 or more positive readings should be considered a positive margin and be re-excised. For example, in the following test case, the deep, superior, and medial margins should be considered positive and re-excised. It is essential and required by protocol to re-excise from the lumpectomy cavity all margins with any positive readings. The orientation of the re-excised margins should be well identified. As before, sutures should clearly identify the new margin relative to the original specimen.